Okay, well, I think we can go ahead and get started. I see a significant number of attendees have joined at this point. So, very excited to kick off the webinar today to talk about regulating the future, a deep dive into healthcare AI governance. I'm going to do a really quick kickoff here with introductions, and then we'll just launch straight into the conversation from there. From a really high level, regulations, guidelines, recommendations, there's this whole alphabet soup of content that's coming out from a whole lot of different sources. I've got one slide here to show on that front. But if you look, these are just some of the recent guidelines that have come this year. We have, the White House executive orders from late last year. We have, updates to the FDA process with, QMSR. We have an update to the 21st Century Cures Act from ONC. All of this resulting in a lot of conversation, specifically around artificial intelligence, healthcare, and ways that it can be, approached in a very thoughtful manner. We brought this panel together today as representatives from some of the largest organizations that consult with many healthcare organizations and member organizations across the world, and specifically the United States. And for the sake of today's conversation, we're going to be talking about laws, which I want to be very clear are regulations. Like that would be the 21st Century Cures Act. Recommendations such as the AMA principles that were put out there, or the joint guidance that came out from from 4 major radiology societies recently on ways to implement AI in radiology. And then governance structures, which is more internal structures within organizations on how they can think about the implementation of AI within their 4 walls. So, from this panel of experts today, there are 3 key topics that we'd like to address and hope you all walk away with some good understandings on. Those are the current state of AI in healthcare and the rapid adoption that's happening, the recent guidelines, some of the ones that we have up here, along with other relevant ones, and then some practical advice on AI governance structures. So with that, I'll lead straight into the introductions. First, we have Sam Johnson. Sam is a partner in Deloitte Consulting's healthcare practice, and he leads the Converge Health asset portfolio. They bring products and assets to life for their most strategic clients. He's been with Deloitte for over 20 years and focused on transforming large provider and healthcare plan organizations by creating differentiated operating models through strategic partnerships, radically disrupting cost profiles through technology, and helping organizations evolve along an emerging digital continuum. We also have Bill Fera, Dr. Bill Fera. Bill is a partner at Deloitte Consulting and the leader of Deloitte's virtual health practice. He advises clients on virtual health strategies that put patients at the center of the healthcare ecosystem. He's experienced in working at the convergence of payers and providers, implementing technology to drive efficiencies and creating practical analytic strategies that allow speed to value. He has over 20 years of experience as a practicing family physician, physician executive, and healthcare consultant. He brings a multifaceted view to healthcare issues and potential solutions. Karen Mandelbaum has joined us from Epstein Becker Green. She's an attorney and has deep experience in all aspects of system security and data protection from her work as a privacy and cybersecurity official at the Center for Medicare and Medicaid Services, CMS, as well as in the private sector. Karen specializes in guiding clients through various legal landscapes and implementation of various programs in areas including privacy, cybersecurity, artificial intelligence, and healthcare regulations. And finally, very excited to have Shilpa Patel with us. Shilpa is the Managing Director of Innovation and Product Strategy at the American College of Cardiology. Shilpa has oversight over the ACC's innovation portfolio, which is focused on the digital transformation of care delivery. Shilpa focuses her effort on developing programs and products with strategic partners to support clinicians and patients. Okay, great. And then I'll stop the slides. Now, before we launch into the conversation, I do want to add a caveat. All of this is emerging. It's changing on a daily basis. We all have a fair understanding of this, but at this point in time, there aren't many experts on it, frankly. So we're going to unpack a lot of things, but just take today as the jumping off point, and hopefully some good fodder for thoughts from your side, and maybe some active questions during the Q&A portion of today's webinar. Okay, excellent. So first, starting with the current state of AI in healthcare. Karen, I'd love to get your perspective. When you approach like governance and ethical considerations of AI in healthcare, how do you like wade through these new regulations? Like I know the HTI-1 update from ONC was nearly 900 pages with content or with comments, and it almost read like a technical reference manual in many ways. Like it was referring to APIs and FHIR and all this stuff. How are you able to like get your arms around that?
Well, that's a really good question, Dimitri. And I'll start off by saying that, lawyers, like all professionals, like to consider themselves to be a master of their art. And it can be really daunting and sometimes very humbling to try to tackle some of those recent regulations and guidance documents, um, because they are so weighty and they're really heavy. And you as you read through, you come to certain points and you say, "Hey, what did I just read? Like that did not make any sense at all." Um, and so what I've discovered is that if I sort of take it in pieces and I rely on other people, either in the firm or that colleagues outside of the firm
Hmm.
to help explain. So it's like finding like a multidisciplinary team to unpack what's in those regulations, because I definitely was not trained to be an expert in artificial intelligence or on algorithm transparency or things like that. And so I need to take a step back. And usually where, reading a regulation was something that, that lawyers felt comfortable doing, we're finding ourselves, I think, needing to rely on other people
That's
and other and areas of expertise, which is really what I kind of think is super important when organizations, healthcare in particular, are standing up or thinking about an AI governance structure. It needs to be, or it should be, a multidisciplinary team of people, not just one individual that takes it on. There might be one individual that spearheads an effort, but there need to be multifacets at the table. There need to be the resources brought to bear so that the organization can really, sort of take its time. Even though things are happening so fast, there still has to be that element of, sort of figuring out where the specific organization wants to go.
That's
And I
a
think
that's a great point. When I was reading it, I was in contact with our regulatory affairs department, with our AI team, technical
yeah.
folks from the like DevOps team to talk about integration structures. I'm curious, Bill, from the perspective of a clinician, like building off of what Karen shared, how do you approach that? Like, how have you thought about that when advising clients, when helping to work through these complicated topics?
Sure. Well, I mean, first and foremost, like we talked about, from a multidisciplinary team, we're going to rely on folks like Karen. We're going to rely on our compliance folks, our regulatory folks, and work across disciplines to understand everything that is coming at us. I do think there are things that have come before that we're building on, right? If we think about the regulations and the direction around software as a medical device, if we think of what we've been living with for a long time with HIPAA. And I think if we just, as it is guiding foundational principles, thinking about secure environments, unbiased environments, trustworthy environments, that we're transparent, and that we create audit trails, you're 90% of the way there, right? So I think that there are these things that have been consistent as we evolved from HIPAA to software as a medical device to what we're seeing right now. But I think it's really important when you understand all of those things to start moving and to create an environment for your organization to move quickly. I think that historically people will see governance as something, a governor to slow us down, where really we need governance to speed us up, so that we get the multidisciplinary team together to create a safe environment and safe sandbox, that we're not allowing people to use public utilities, that we're using safe private secure utilities to avail ourselves of generative AI types of applications. And I think most of all, it's a call to action. These are things that should have been, and for the most part do exist in organizations. It's just now that the CEO really cares about the governance of generative AI, and the board really cares and wants to know what's happening in these aspects. So I think there's a much brighter light that's being shown on these issues. I think there is the ability to evolve from where we've been, and that we can use governance to move very quickly and move faster than we otherwise would if we didn't have those guidelines and that advice.
Yeah, no, I think that really resonates. I was watching I was watching Moana with my kids the other day. Imagine that. And wayfinding, knowing where you are by knowing where you've been. And I think that's a very important aspect of considering how to approach all this kind of stuff. So Sam, also from your perspective, working with C-suites across large healthcare systems, plus other healthcare vendor organizations.
Yeah.
How are you engaging them in these topics? Like how are you finding that going?
Yeah, I'll start with this. I mean, I think the biggest challenge that most of our clients are facing is around balance, because Bill's spot on, right? I mean, I haven't talked to a board or a C-suite that doesn't want to know more about generative AI. The challenge is, at least on the provider side of the equation, I mean, they're operating with low single-digit margins, right? And so they know they've got all the data in the world. They know they have to move into this AI-enabled future. They know they need to solve for 3 customers: this patient member, their providers, as well as their workforce. What started as art of the possible type conversations, but grounded in some level of pragmatism, always has to have this eye towards ROI, right? And so we're really coaching them to create these self-sustaining models that can allow for future investment in longer-term innovation. Don't try and hit the home run from the start. Base hits tend to add up, and I think that's some of the coaching that we're trying to provide them. Don't get me wrong. I think at the same time, the balance comes into not stifling innovation, right? I mean, if you take an adage from Amazon, you need the 1,000 points of light. You need the 1,000 flowers blooming, so that way you can create the mechanism to identify those things that are going to add value to your organization or add value to an experience in the 3 members that I talked about. But I think it's that balancing act is a challenge for a lot right now, and shepherding through that is kind of where we see our role evolving right now.
That's perfect. So moving on to the next topic, but I think to wrap that one up, a multidisciplinary approach, not going this alone, really important. Recognizing the full context of where we've been, so we can figure out where we're going, and then really creating governance as a mechanism for innovation is quite important with all of this. So Shilpa, from the American College of Cardiology perspective, I know cardiologists are heavily involved in AI. I've been to the conferences, plus have many conversations with them there. Practically speaking, how are you guiding your members? How's that working out?
Yeah, so, I mean, the honest answer is that it's hard, because, AI is literally in every aspect of our lives, and, it's not going to go anywhere. It's only going to probably become a larger part of everyone's lives. And I think for the most part, clinicians and clinical teams are really just trying to understand and make sense of the influx of AI into care delivery. And for the most part, they see a lot of opportunity there when implemented correctly, but they just want to be able to instill trust with AI and ensure that there's transparency when it comes to implementation of AI. So really understanding how and when to apply AI and in what situations. At the ACC, we like to call the application of AI collaborative intelligence. So, AI is there to enable and support clinical care teams to really do what they are highly trained to do, take care of patients, and really take some of that non-clinical burden away from them.
That's a great point. So Karen, you're being approached. Shilpa and her team are working with the cardiologists at systems now. The systems are looking to implement this, and your clients are coming to you for guidance. How are you guiding them on all these recent regulations that I was talking about at the beginning there?
So a lot of companies come to us, and and I'll just take a step back and talk a little bit about HIPAA compliance as an example. Right? Because we do want to learn from the past. And a lot of companies over the last 25 years were reticent to, to implement like the full panoply of like the HIPAA elements, right? So it was costly to do a security risk assessment. So that might have come second. And, written policies and procedures were burdensome. And so they were done more piecemeal. And there are still companies out there that have, more operational safeguards in place, but don't really have a formal HIPAA compliance program. When we talk about AI governance, and the conversation that's sort of emerging here is really, it's really enlightening, and it's good to hear, because what it says is that taking that first step it's never too soon, right? So setting up, making those investments in identifying, sort of the things that are in place already, the policies and procedures that the organization has that are working and that will work, is important. Being able to leverage the existing infrastructure, whether it's IT teams that are already using certain types of technologies that rely on artificial intelligence, that can help other parts of the organization recognize the value that they can add, or the improvements that can be achieved. It's always important to look within. And what's important about having policies in place and a sound infrastructure in terms of the types of things or the types of activities that artificial intelligence will be used for, and how they'll be monitored and how they'll be audited as time goes on. It's really important for an organization, because that's the infrastructure that will help figure out like when something goes wrong. So oftentimes we get this phone call from a client where they say, "We think we had a breach. What do we do?" And the obvious answer is, well, dust off that incident response and breach notification plan that you put in place at some point in the past, and start running with it. And they realize, like, oh, they don't have to necessarily go to their lawyer or go back to HIPAA as the guideline. They have the infrastructure in place, and that's why it's so important for now to start building that infrastructure that will help understand what the roadmap for deploying AI technologies is.
I think that's that's a great insight. Like this is new, this is emerging, but we do already have a lot of infrastructure in place that we can leverage. I never quite thought about that way, like looking at the existing incident response protocols. Now, you did mention something like the ability to assess what's happened. And when you're doing a security audit, that's kind of easy. You look at who accessed what, how they accessed it. What AI transparency, I think, is going to be a similar subject. Across all of these guidelines, across all of this regulation, transparency is the key term that you find mentioned in them. Sam, Bill, I would love to get your perspectives from your engagements. How are you guiding folks on ways to approach AI transparency from a practical perspective, a day-to-day utilization perspective?
Yeah, and Bill, I'll start, but I've got a very tactical example actually. And so you were asking earlier about the regulations and whether or not Karen was excited about the fact that they had APIs and FHIRs in them. For the fellow nerds on the call, I was thrilled that they had FHIR and APIs, right? But I mean, there was recent regulation. I think it got finalized in January, where CMS finalized the rule to expand access to health information and improve the entire prior authorization process on both the plan and the provider side of this. I think it doesn't go into effect until 2027. And so our clients are actually moving in a direction to adopt those standards to transact around authorizations in a very FHIR-based Da Vinci coded manner, which is great. As a result of that, we've actually been exploring the use of generative AI to be able to mine medical policy data, to mine medical record data, to mine local coverage guidelines and national coverage guidelines, to be able to identify, which accounts require an authorization, if they were an authorization, how do you prove medical necessity, et cetera. And so doing that, we've had to employ generative AI to be able to read, if you go to the Elevance website and type in policy, you'll get 478 individual PDF files, right? So it's an enormous amount of data. So generative AI, these large language models are really the right solve for that type of application, which is fantastic. I think what we've had to figure out how to do is to build our search parameters and our criteria and everything so that it creates an audit trail associated with how it's actually combining those data sets together to prove out a specific answer or result. And I think that is that's going to be the challenge I think that a lot of developers have in the near future, is ensuring that not only do they get the right answer, but can they show their work, right? I think back to my math tutors back in the day, but we've got to be able to show our work in order to actually to get this right. So Karen can do her job in the event there is a breach at some point in time, right? So but we're making it as part of almost our SDLC at this point. So our software development lifecycle includes our ability to create outputs that are auditable, traceable, defensible, et cetera, transparent, to use your term. So that way we can do the necessary things when it comes to ensuring that we're not taking a black box approach to AI.
So Sam, I didn't know you were a fellow API nerd. I did a search of our federal registry recently, like the recent updates, and found over 500 mentions of FHIR in it.
That's awesome.
Government.
I'm excited about it.
But yeah, I mean, I think it's just so quickly being pushed, frankly, like this interoperability of the transparency and across organization understanding of what's going on. Bill, I'll come back to you in a second. Actually, Shilpa, I would love to get your perspective from an ACC perspective on what you're doing to drive AI transparency forward, like how you're guiding clinicians and different things like that.
Comes to kind of the AI transparency piece, we're kind of going back to kind of the clinical use cases, like what are they? Because that's what a lot of people ask, where should we apply AI? Where is it safe to apply AI? And when we're thinking about that, we kind of think about, there's a lot of AI solutions out there. There's a ton of AI algorithms out there. But really for them to be implementable, they need to be part of platforms and be part of systems. And so really starting with AI implementation from the lens of starting low risk, high impact, and really starting to build that trust and transparency so you can see how it's working. So when I think about that low risk, high impact areas in clinical care, you think about decreasing that non-clinical burden. So really using technologies to help with clinical documentation, summarization, starting to look at imaging processing and risk stratification, where you can still have the clinical checks in place. So while the AI is running, you have a clinician or clinical care team member always in the loop, understanding when and how the AI is being implemented. And I think through that trust, you start getting a greater transparency. The other thing is, I think companies have to be transparent about how their models and algorithms were built, what populations they were tested on. And also being honest about, what are the limitations? And so as these are being implemented in real world scenarios, people are really aware of kind of the limitations, the indications, and just kind of going into it with, eyes wide open.
Yeah, that's a great point. So this is actually a perfect segue back to Bill. You bring the joint perspective of not just an advisor to the organizations, but a physician yourself. What's your take on that? How would you approach that as a physician actually using this potentially, within a health system?
But yeah, I mean, I think building on what Shilpa said, I mean, this is an exciting time as a clinician, right? That as we set up the guardrails and the governance, that we can start to avail ourselves of these technologies in ways that meaningfully impact our work. It's actually making healthcare digital. I would argue that healthcare has been electronic for about the last 15 to 20 years, but it certainly hasn't been digital. Any technology that slows you down, I don't think we could classify as digital. But it's interesting how I think it's going to pivot attitudes and measurements in the way that we move forward. And Sam talked about 1,000 flowers blooming. I think in any individual healthcare system, I'd settle for 100, but that's funnel that quickly down to 5. and let's make sure that they actually work. So, I see some things that are really spreading quickly, are things like ambient documentation.
Yeah.
And it's interesting, the first questions that come up with physicians, right? And I think this in some ways speaks to trust from an organizational perspective. So what are you going to do with my time now that I'm more efficient? Are you just giving me this thing so I can see more patients? Are you going to increase my RVUs? Like what's going to happen with this time? And so I've been thinking about that a lot. And then I started to think, well, what if I did have to see more patients? So let's say right now, the most I can see in terms of patients in an hour is 4 to 6, depending on your population and how sick they are. For specialists, obviously that's going to be different. I'm speaking as a primary care physician, but the bulk of my time was administrative stuff. You know, I was worried about searching through the chart to find the information. Then I had to document my visit. Then I had to bill the visit. Then I had to make sure I had the right referrals and the right prescriptions. And a lot of those things take time. But what if I just was going into a room, I had a synopsis of what I needed right in front of me, and then just talked to the patient, told the patient everything was going to happen. And when I left the room, all the other stuff was done. The bill, documentation was automatically done. Referrals were done. Prescriptions were done and sent. Coding was all done. And now I just had to walk to the next room to see a patient and have another synopsis ready for me to see the next patient. Why wouldn't I see more patients? This is what I went into medicine for, is just to interact with patients. So, I think it'll be really liberating to see how, as we become digital, as we really digitize our workflows and our interactions with fellow clinicians and with patients, it'll be fascinating to see how much we can unlock and how it affects the attitudes of our clinicians that have been suffering for so long, and rightfully and understandably. So I think there's a lot of excitement that's being brought because of what's possible now.
I mean, I think the reduction of pajama time, which is obviously a well-accepted term for, documenting from your bed, is an obvious opportunity for artificial intelligence. I do think there's also the opportunity to deliver more personalized medicine, to get to patients before they progress. Catch it. I think about our American College of Cardiology partnership, that we have from the innovation side, focused on early identification, like turning coronary artery calcification as an opportunity for primary prevention instead of secondarily addressing it.
But I think, as Shilpa said, Demetri, sorry to interrupt, is that, as we get into the more clinical use cases, I think that, people are very anxious to get to the non-clinical, because it's going to take away the things that they don't want to do. But as I think Shilpa is starting to say, that, and Sam alluded to, and you talked about sharing our materials and methods of how we got to the results. I mean, that's not new for clinicians, right? People, we read research, and the thing that we should pay most attention to when we read our research is the materials and methods. Because many times, if you actually read that, it doesn't necessarily correlate with the conclusions that the authors came out with. So being able to benefit from that transparency, to be able to make your own decisions. Do I believe that this was the right data set? Is what's coming out of this model, do I agree with it? And so being able to pressure test and earn that trust of the clinicians as we move forward will be incredibly important as we get to the more clinically relevant use cases.
Yeah, I think that was something that I really took away from those, regulations I was reading, is it's not just the input points, like it's not just how you build the model, but it's how the model's applied, and providing transparency, particularly in a clinical use case, to the physician, that, this is how we arrived at the decision we arrived at, or the guidance or the information that, that's being shared as part of that workflow in there. So.
I was just going to say, Demetri, Bill, I'd be interested in hearing your perspective on the the convergence of where the clinical world is meeting the non-clinical world in the Accountable Care Act demonstration models and the ACO models and things like that, where clearly clinical work is being done, but it's being shared also with non-clinical professionals like coaches and whether it's for exercise management or for food and nutrition management and things like that, because data is really at the core, and being able to cull through all those patient records and things like that of a successful ACO program or value-based care program. I'd be curious to know how what your experiences are in that area.
Those are certainly evolving. I think there's much more discussion, I would say, to this point than there's been activity. But I think where people are starting to point to is this idea of digital assistants or digital avatars that are going to be along for the journey with patients, where the digital avatar does know a lot of information, as you're saying, Karen, right? So they know the medications, they know they're going to know what blood sugars have been trending for patients as we tap into more wearables. They're going to be understanding what the trend in their blood pressures have been. And they're going to be interacting with patients to say, you know, how are you? Have you been taking your medicine? Did you notice that your blood sugars have been trending? You know, and so I think that's a future, again, that will come more rapidly if we follow the guidelines that are being laid out with transparency and earning trust. But I do think that extension of, as you said, health coaches, of care managers will become a very natural one. And I think care managers will be able to oversee and interact with many more patients because of the extension of an assistant that will allow them to do their jobs more effectively.
Well, I think so AI is obviously the topic of conversation here, but it's not happening in a vacuum. We have, you know, things like Apple Watches as an example, or any smartwatch that's, you know, grabbing your heart rate, your O2, if you have AFib, like, you know, or theoretically, like identifying you may have AFib. Let me rephrase, but like there's all this information that is being created at this point. How can physicians know how to work with that? It's so much noise. How do you find the signal in that? At least from my perspective, I think that's where AI is going to really be able to step in and offer some guidance. Like, hey, this is the trend we're noticing across these 1,000,001 data points that are net new. Insight.
Yeah, I think that analytic layer and then decision routing and decision trees will allow this thing to start to be accepted. So to Demetri, I think people are fearful. I've got all of this information that's flowing into my electronic medical record, and now am I responsible for that? You know, I can't possibly be looking at every reading that's coming in. But now, if we have this transparent, trusted analytic layer that is only available, you know, notifying me when it makes sense. Like probably the first step is, as we talked about, notify a patient. The next step would be to notify the care manager. The next step would be to notify a nurse, and the next step would be to notify a physician, depending on what the result with the readings are. So I think building out those types of algorithms and models will be a natural sequencing of what we're going to see as where wearables meet records and clinical care.
Demetri, I'd also add there, I think that, you know, with the increased amount of data and the opportunity with AI, we have to be careful that we're not adding more reports, more like singular platforms. So I think the platform in which these technologies are coming into is probably the most important thing for these to be embedded into the clinical workflow to allow them to be really, really used. You don't want a clinician having to go to 5 different windows and look at, you know, 5 different data reports, even if they are actionable data points. It's just too many entry points. So that platform is critical, I think, to implementation success.
I could not agree more. And I think, Demetri, that you talked about interoperability, right? And that interwoven with all these guidelines, kind of quietly, but more and more forcibly with APIs and FHIRs, we're driving and driving and driving towards interoperability so that we can create this fabric like Shilpa was talking about that allows a platform approach. And I think it's going to be really interesting as organizations start to really understand generative AI and how accessible it is, how people's minds are going to shift from what am I buying, what am I partnering with, and what am I actually building? And even when I'm buying, how much am I building / monitoring on that last mile of data and managing my own data and that training of the model there? So It'll be interesting as these fabrics evolve, as the platforms evolve, and building becomes more accessible, and vendors are more transparent. It's going to be an interesting, dynamic between clients and vendors, and how they're adjudicating what's being built and bought and leveraged within this fabric.
Yeah, I think as having started in radiology with our initial AI use cases, and continuing to grow there, of course, but also expand, we've been both lucky and to have experienced the maturation of the space, but also as a result of that, we've experienced some of the challenges, and some of the good guidelines that were released early on, like the CLAIR guidelines that came out 2-3 years ago, is literally evaluating whether or not to build or buy AI in radiology, and how you approach the adoption cycle of that, how to assess the value and the performance of the solutions, some very early considerations there. And Bill, you made a comment about weaving it all together. I think that's a great point, that this is now a like massive mesh of information that's coming in from all different kinds of data sources, that probably needs to be normalized. Like, that's part of the other thing. Like, there's variation in how information is collected and how it's documented and how it's shared across these environments. So it's even harder for the clinician. But I think, again, there's some great opportunities to create like digital twins and full contextual understanding for digital avatars. There's a lot of different words for it, emerging along with this technology, to go there. So I think, just because we're running short on time here, moving to kind of like the next subject, Sam, I'd love to get your perspective on what your aha moment was in AI. Like, when were you like, this is real and it's going to be something that's going to impact us?
Yeah, and this is going to sound like an advertisement, so I don't mean it to, right? But I did have the opportunity to go to Israel about a year ago and met with the folks at Sheba Arc, and had a chance to see an AI platform that was being applied to radiology, and it happened to be called Aidoc. And to me, I mean, what I had encountered up until that point was actually, these random acts of innovation, right? Which, again, the 1,000 points of light, great. We're not stifling innovation. We want innovation, but it's happening, it's prolific throughout the organization without a cohesive strategy. Shilpa, without a platform that you were talking about. I mean, that was evident from the start. And I think, what I saw at least was an opportunity to actually leverage a consistent, cohesive platform where you could spin up and light up net new algorithms, net new AI solutions, and apply it more broadly across your enterprise. So to me, that was a really good example of where I've seen it done well. I think the trick is, I mean, you already have to have the data. You have to have the data cleansed and normalized. You have to have it in the right quantity, organized and scaled data sets. I think imperative is that platform approach. Otherwise, you end up with those random acts of innovation. Bill, I think you said it earlier, but I think there has to be kind of a C-suite imperative when it works well. There has to be a top-down mandate to say, yes, we're going to embrace innovation in digital and AI, and we're going to do it, using the infrastructure that we're standing up or have laid out already. I think there's got to be a strategy, and without a cohesive strategy that all of this can hang off of, I think you end up in a little bit of a muddy situation. And then lastly, I think we want to be able to see that there is some hybrid between a federated and a centralized model, and you've got the ability to provide, your clinicians, your other ancillary areas throughout the organization, guardrails around their innovation journey, right? We want them to innovate. We want them to think through ideas. And where we've seen it done well is where there are established protocols for how to think about innovation that can ultimately come into that funneling mechanism where we get down from 1,000 points of light to 5, right? But if we can give them the method and the plan and the approach to go from an idea to something that's tangible and real, I think those are the organizations that have succeeded in this space.
Great point. And for those 5 points of light from a governance structure perspective, Karen, Bill, would love to get your perspective. Like, I think you've already mentioned it has to be multidisciplinary. It's not siloed, but who leads? How do you joint own this across so many different domains?
So I would say this, that what Sam just described is a lot of what we've sort of woven into a plan for organizations that is akin to what an oversight or an enforcement agency would be looking for. Would they look to investigate, or if there were problems associated with an AI tool being used that might come up? It follows the 7 elements of an effective compliance program in healthcare, right? It's the sound protocols that Sam described, which in my nomenclature are the written policies and procedures. It's designating a compliance officer and a compliance committee. Maybe it's part of maybe it sits under the board, or maybe it's it's a committee that is separately designated, conducting training and having education across the organization, having open lines of communication, being able to audit and monitor what's the technologies that are being used, and then making sure that if people are doing things wrong or bad within the organization with the artificial intelligence tools, that you stop them. You have an internal enforcement structure, and you don't let bad things fester. You deal with them head on. And that will help organizations sort of feel more comfortable moving forward, we feel, because it's the sort of safety net that they already use in other areas, like in fraud, waste, and abuse, and in those types of oversight and compliance areas. And it's also familiar to the regulators. So even if the regulators are busy writing these rules that force, that have some elements of forced compliance on the industry, they might be slow in figuring out what the oversight rubric should be. And if you have something that makes sense to them, then oftentimes they're placated, and they allow you to do what you do best, and that is take care of patients and use these tools to make it better and to save money and to be more efficient.
That's an excellent point. I think back to when I was reading like the executive order and that ONC update referring to OCR, and it's having that consistent structure across new domain and ones that have been around for a while. Very important. So Bill, who have you seen on some of these AI governance committees and structures that y'all have been working with?
Yeah, so I think, you mentioned the executive order, and one of the recommendations or guidelines from it was the creation of a chief AI officer. And so when you have the chief AI officer, you have that focal point of where decisions are going to be made. But to Karen's point, it has to be heavily matrix across all of those parts of the organization working very seamlessly together. So you have to be working with clinical, you have to be working with IT and DevOps, you've got to be working with security, you've got to be working with regulatory and compliance, and you've got to be working with finance and operations. So what we see people who are successfully moving forward and quickly moving forward is they have these stage gates of understanding, what opportunities are going to move forward in the organization or not. And I think that's how you build trust, is if you can quickly say yes or no to opportunities, and you have a series of gates to make the decision. So first and foremost, is this going to be good for our patients and our clinicians? Okay, is there a business case for it from the standpoint of being able to deploy this? And the business case doesn't have to be strictly financial, right? It could be from other elements of quality or quality of life. Okay, is it doable? Is it feasible from an IT perspective? Okay, does it comply with regulations? And you move through these gates, however you decide, but you have to do it quickly. So you have to have the whole organization on board and working together. And so those organizations that are able, that have that internal trust, that they can work together quickly, they can align on what those decision gates are going to be and how we prioritize use cases. And when we kick them out, because everybody talks about how you get to yes, but it's really important also to know when to say no. And then once you engage and you go forward, discipline is extremely important. And so many of our clients we see have a lot of pilots languishing, and we'll ask, is that working? I don't know. Seems to be. Well, that's a really powerful answer. So, making sure you have those indicators and metrics going in that we can declare success or we can admit failure. But either scaling quickly or stopping are really important parts of the decision of the governance structure.
Yep. No, that's yes, and that understanding of, because a lot of AI, I think, is a solution looking for a problem, right?
Yeah.
And if you don't understand the problem, you can't assess the value and ultimately understand the impact. So I think this actually leads well into a Q&A question that we had. And Shilpa, I'm going to put you on the spot if you don't mind, because it was addressed directly to you. And it says, keeping clinicians in the loop to guarantee transparency. You keep mentioning that, which you did, and I think appropriately. So are clinicians ready to interact with AI systems that do this? How do you prepare clinicians to understand and work with AI from a member, group organization perspective?
So I think, clinicians are ready to work with AI. They already are working with AI, and they have actually been working with AI for a really long time in different ways. I think that the way to kind of think about it is from like an AI literacy standpoint almost. I think it's trying to get the clinical workflows up to speed on all of the elements of AI that are non-clinical. Clinicians know the clinical very well. It's figuring out where and how to implement it and really being clear and transparent. And so I think, a lot of times, again, when these companies come to health systems and clinicians and they say, got this algorithm and it does like all these 20 things, which is great. But for a clinician, they want simplicity and understandability quickly, so they understand where and how, again, to implement it. From the college's standpoint, what we're trying to do is we just launched in March of this year an AI resource center. And it's really a curated hub of content for clinicians. It's really showcasing all of the regulations that are coming out from the federal government, but also talking about specific use cases in clinical care delivery. So sharing those best practices and how clinicians are adopting these technologies and where they're seeing success, and then also talking about the metrics, like what are the metrics you need to look at that showcase that this technology is working or not working. We don't have well-defined metrics for technology adoption yet, and we may not get to the outcomes immediately, but being able to have those intermediate metrics in place is essential, I think, especially to see increased clinical adoption for those technologies.
That's a great point. And a funny story about the AI information center from the ACC. I saw it on LinkedIn and thought it was great. I reached out to Shilpa to ask, who was collating all that and putting it together, and she was like, "Well, me and my team." So it was a good job, and I think that is very important because it's providing clear guidance to your members. Like, here's a whole mass and raft of information that's out there, but here's some boiled down perspectives and pieces on it that I think are invaluable. So I think that covers some great details about the ACC and their approach on it. Karen, from your perspective at Epstein Becker Green, how are you all engaging in this conversation? How are you helping your clients and prospects on this?
Well, we're busy with answering the like the legal questions, like so how do we comply with this rule? What do we how does this rule apply to us, right? Like the HTI-1 rule that ONC put out. There were a lot of people that thought that the rule would apply to them because they have algorithms, but it really applies to those EHR vendors that deploy them and that offer them and that have them in the technologies, right? And then we anticipate that there are going to be questions from providers that are to come because now that there is this algorithm transparency, the sort of the burden kind of shifts to the provider to ensure that they're following and making sure that the algorithm is actually working within the patient group, their patient mix or within their organization. And so the question becomes, now that now that a hospital or a physician group is using the technology in the EHR, they're going to have to keep track and pay attention. And so, so there is the potential for there to be, questions that come up. Does the algorithm really do what it's supposed to be doing? Are the metrics actually, accurate? And those kinds of questions may come up. And so we're getting ready to anticipate those types of
Yes,
issues.
as I was reading through it, that HCI one update, I had to go all the way back to the Affordable Care Act of like 2009. And then that got me down a rabbit hole to HIPAA in 96 or whatever. Like, it's because these are all related to each other.
Yeah.
It's, the scope comes from here, which came from there. So yeah. From a Deloitte perspective, I know, Sam leading Converge Health in that part of the portfolio. How are you all approaching, this from your client perspective and working with them?
Yeah, no, good question. I think there's kind of three ways in which we're doing this, and Bill would love you to weigh in as well. I think there's clearly the strategy and implementation side of the equation, right? Where we are actively helping clients establish a plan, our roadmap, identify use cases, prioritize those use cases, qualify them, quantify them. So I was alluding to earlier that everybody's looking for the ROI on these, and they may not be monetary, but still needing to actually articulate what that is. And then, ultimately demonstrating the capabilities of AI through POCs or development or demos. But I think the other two sides of the equation that we play in is, one, we do hands-on keyboard work, custom development for AI solutions for our clients directly, right? So anytime that they're looking for help augmenting their existing teams to be able to build out solutions utilizing data sets that they've got or have curated, we're absolutely willing to partner with them to do that. And then the last way, and it's a little tricky, but in the productizing side of this, right, where we are actually building AI products that we're in market bringing to our clients. I think we had, and I saw some of the questions in the Q&A on this, but we did go down a path exploring the idea of utilizing AI or even workflow on the clinical side of the equation, and stepped clearly into the SAMD territory, the software as a medical device. And it gets complicated very quickly, and I'm sure Karen can speak a lot about software as a medical device. But from my perspective, from Deloitte's perspective, we've kind of, at least from our product portfolio, we've kind of indexed on the non-clinical aspects of AI and being able to, improve experience, performance, and achieve ROI in those areas. So I think that's just an easier place, just from our overall organization, for us to play in.
Yeah.
But those are kind of the three ways we really address this space. But Bill, I know you're actively leading a lot of those conversations right now in market. Do you want to talk a little bit about that?
Sure. I mean, I think for our clients, a lot of it is, as I mentioned before, this has become a call to action, right? So how do we solidify some of the structures that have or could have been sharpened or from the standpoint of their existence? So do you have the right governance structures? Do you have the right infrastructure strategy? Do you have the right data strategy? Do you have the right security around those parameters? If you are going to purchase vended solutions, how are you going to integrate them with your data and make sure that your data is ready to be available to be trained? So, we talked about different things in being able to use your data. Vended solutions that came out through EMRs like sepsis detection they don't work out of the box. You have to train them on your data and your local data set. So having the capacity to do those things, from an internal perspective, just an example of how we've been establishing our own governance and helping our folks use AI responsibly is that we, like a lot of organizations, decided to do a private version of ChatGPT. So our people aren't going out and putting private data out into a public cloud and in crossing those boundaries. And so we just have a redirect now. Anybody who types in ChatGPT goes to our internal GPT's sidekick. And so that's a governance structure that makes it easy for us to access the tool that we need to access to be able to do searches responsibly in a secure fashion. And so, we're learning ourselves as we go along, and then also taking those learnings out to our clients and helping them to accelerate their process and their progress along the AI and Gen AI continuum.
So ultimately, whose responsibility is it to govern AI? Like you've got your internal governance structure that automatically redirects. So is this on the providers and like the AI committees? Is it on the regulators? Is it on the vendors? Somebody third party, like what's it developed around HIPAA? Whose responsibility is that? Open question.
I think we all talked about it's multidisciplinary, right? So it's going to roll up to a series of individuals, like anything that happens, if anything majorly bad happens in an organization, it rolls up, right? So I saw the questions about individual physicians, and we talked about, physicians in the loop. Physicians are still at this point responsible for making decisions and will not be replaced. Right? There's going to be suggestions made to physicians. Physicians will decide ultimately if they agree with that suggestion or they don't agree with that suggestion. They will have to document why they did what they did, just like they do now. Walk through a differential diagnosis, create an understanding, a narrative of why they decided what they decided. And I think that that's a tried and true methodology of communicating effectively and protecting yourself from a legal perspective. So, once you get past the physician, you'll go up to chairs, you'll go up to CEOs. I think it's an interesting development. I talked to a policy advocate who said that and this alludes to one of the questions that was in there too. I don't know what's going to happen with this, but the medical malpractice insurers are exploring how they could defer some of their liability to software vendors or to AI companies. And so is that going to become part, and Karen can speak much more eloquently to this than I can, but is that going to be part of the sales process now, or the acquisition of these products, and what is going to happen with MedMal and what's going to develop there? So those are more questions for me to throw on the pile than to answer, but those are some of the trends that we're seeing.
So we've got 1 minute. If I could rapid fire, how are you all staying on top of this? Start with Shilpa. How do you stay up to date?
Well, I think me and the college, we're constantly monitoring what's coming out from the federal government, from all the regulatory, from a legislative landscape. But we know policy change is going to take time. So we're working with other industry stakeholders to kind of develop an AI framework for implementation, and also considering both at the national, but also at the local level, because a lot of this implementation is going to be local because healthcare is local. So we really think, no one organization can really do this alone. And then the other thing is we're working directly with technology companies. So gathering those insights on product development, tech development, like with you guys, Demetri, and so that we can ensure that these technologies are built with the clinician workflow in mind and patient experience and engagement, because again, that's how they're going to actually scale.
Yep. Karen?
So at Epstein Becker, we have an AI work group that meets monthly, and there we have dedicated library staff that keep us up to date. We actually have clients also that we do landscape and we do regulatory landscape work for. So we do the sort of summaries. We prepare the summaries of sort of what's happening on the Hill, what's happening in the different agencies, what's happening across the different industries for clients. So I'm part of those types of efforts. I have all sorts of friends and colleagues that send me interesting articles and things like that, and I just am so interested in it that it's like the thing that I do in my my pastime. So it's in my blood, I guess I would say.
Okay, so we're at time, but stay on, Bill. I'd still love to get your perspectives if you have one.
I'll give you a podcast. No, just kidding. I think talking to clients, really trying to understand what challenges they're trying to solve for, I think is the easiest way for me to ensure that whatever great ideas are coming over the line, we're actually able to apply them in a way that makes sense in this material.
I think Karen hit on it, really just being active learner, getting different sources. We have a compiler that puts out releases about different news. You surface your own news sources. I do think it's just fascinating. I would talk about electronic medical records to physician groups, and probably from 2004 to 2009, my talk did not change. I had the same slides for 5 straight years. And now you cannot go with the same slide deck for 5 weeks. It is changing. I mean, daily it is changing. It's amazing. And it's a challenge to keep up, but you just got to.
Great. Excellent. Well, we are at time, and thank you so much. Really appreciate the conversation. I hope you all found it lively. I know I enjoyed it. So thank you.
Thank you, Demetri. Thanks all.
Thanks, everybody. Thank you.